Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering questions that are part of the fundamentals of nursing, also known as foundations of nursing. And to be more specific, I'm going to be covering pain, rest, sleep, and comfort. If you haven't done so already, guys, please don't forget to like and subscribe below. Also, don't forget, I'm also now on TikTok and YouTube. My handle's still the same, Nexus Nursing. I also have a podcast. I'm on every major streaming platform. I cover questions for nurse practitioners, and I cover a lot of issues for nursing students, as well as my audio lessons, guys. I have audio lessons on my website, Nexus Nursing Institute. If you are in the nursing program right now and you're struggling with a particular subject or concept, I actually break it down. I explain to you what the textbook is trying to say, and I point out to you the most important contents that you're most likely going to see on your exam. So make sure you check out my audio lessons on nexusnursinginstitute.com. So guys, without any further ado, let's get started. First question. The nurse understands that a patient who has difficulty sleeping may have shortened NREM. NREM, guys, that's non-rapid non-rapid eye movement. NREM, non-rapid eye movement. Okay, so the nurse understands the patient who has difficulty sleeping may have shortened NREM sleep. Therefore, the nurse should assess the patient for 1, decreased pain tolerance, 2, excessive sleepiness, 3, confusion, or 4, irritability. And guys, the correct answer is 2. If that NREM has been shortened, you expect that patient to be tired. They're going to be sleepy. They're going to be fatigued. They're going to want more sleep because the NREM has been shortened. Let's say you guys had no idea what the answer was. Guys, look at your choices. The only choice that has something to do with sleep is 2, excessive sleepiness. Okay, and in the question, they tell you the patient had a shortened NREM sleep. Let's say you didn't understand NREM, you know what sleep means. So you would have, even if you didn't know what the answer was, when you look at your choices, you should have said to yourself, well, which one is the one that sticks out? And the sleepiness is the only one that has to do with sleep, and you should have chosen that answer. By the way, guys, like I said, when NREM is shortened, the patient's going to be tired because they're going to feel like they need more sleep. They're going to be sleepy. Next question. The nurse understands that the shortest acting pain relief method is 1, patient-controlled analgesia, that's your PCA, 2, IM sedatives, 3, IV narcotics, or 4, regional anesthesia. And guys, the correct answer is 3, IV narcotics. Now, even though IV medications, the onset is the quickest because it goes directly to the bloodstream, yes. But guess what? The duration's also the shortest when it comes to narcotics, and that has to do with the bio breakdown, right? So even though, yes, the onset's the quickest, the duration also is the shortest. The correct answer is 3, IV narcotics. As soon as you give that IV narcotics, it starts to work immediately, guys, within minutes, but it also doesn't last too long. Now, let's look at our other answer choices. You have 1, the PCA. PCA is intermittent. Remember, that's the one where the patient presses the button where they feel pain. That's intermittent. That can last hours to days, depending on the type of narcotic that's given. 2, IM sedatives. This one can last when it's given intramuscularly, can last for the patient about 3 to 4 hours. And then 4, regional anesthesia. That's something like, guys, your epidural or your nerve block. This also can last for a couple hours, maybe about 1 to 3 hours, but definitely the shortest acting one is going to be the IV. Even though the onset is the quickest, the duration is also the shortest. Which concept associated with sleep must the nurse understand to best plan nursing care? 1, bedtime routines are associated with an expectation of sleep. 2, alcohol intake interferes with one's ability to sleep. 3, sleep needs remain consistent throughout the lifespan. Or 4, total time in bed gradually decreases as one ages. Guys, if you've been following me for any amount of time, don't worry about me. I love my coffee. I'm going to sip on this while you think of the answer. Just press pause if you need a little bit more time. Okay, guys, and so the correct answer is 1. Bedtime routines are associated with an expectation of sleep. And guys, this not only goes for adults, this goes for pediatric patients as well. For the patient to get the best quality of sleep, you teach them to establish a bedtime routine because it trains the brain to prepare for sleep. Wind things down. Soft music, low lighting, reading, praying. Have some type of routine before you go to bed, and it trains your brain to just slow everything down and prepare for sleep. Number 1 is the correct answer. Now let's look at our wrong answer choices. 2, alcohol intake interferes with one's ability to sleep. As much as many people think that alcohol is stimulant, because you think of people who are drunk and they're rowdy and they're all like this, but alcohol is actually a depressant. It slows things down. But we're not going to tell patients to drink alcohol to go to sleep. Is that healthy? No. But you know that number 2 is correct. Number 2 is incorrect. It doesn't interfere with one's ability to sleep. It's a depressant. It may actually make the patient sleep. It is a depressant, but it's not healthy, so we're not going to tell the patient to do it. Number 3, sleep needs remain consistent throughout lifespan. No, it doesn't remain consistent. You know, the sleep needs depends on the patient's activity tolerance. Activity level. Okay, so the more active a patient is, the more rest they're going to need. It depends on the activity level. It depends on their health. It depends on the patient's age. So that's incorrect. And then number 4, total time in bed gradually decreases as one ages. That's actually false. As one ages and one goes into the older adult geriatric population, this patient tends to spend more time in bed but less time sleeping. Okay, so the correct answer is number 1. A patient has been in the ICU for 2 weeks. Which nursing diagnosis associated with sleep deprivation is most appropriate for this patient? 1, risk for disturbed thought process. 2, impaired gas exchange. 3, disuse syndrome. Or 4, powerlessness. And guys, the correct answer is 1, risk for disturbed thought process. So guys, this is also known as ICU psychosis. If a patient's been in the ICU for long enough, they may become out of touch with reality. And that's what psychosis is, out of touch with reality. The great thing, guys, is that this is reversible. The patient can be reoriented back to reality. However, with the patient being in the ICU and not getting enough sleep, they can have ICU psychosis, and the nursing diagnosis for that would be number 1, your risk for disturbed thought process. The patient's cognition decreases. The nurse understands that the internal stimulus that most commonly interferes with sleep is 1, ringing in the ears, 2, full bladder, 3, hunger, or 4, thirst. And guys, the correct answer is 2, full bladder. So another important teaching you want to teach the patients to get the best quality and quantity of sleep, you're going to teach the patients to empty their bladder before they go to bed, especially older patients. Number 1, a full bladder is going to interfere with their sleep because they're going to have to get up to go urinate. And number 2, if it's an older patient, a patient part of the geriatric community, what happens when you're awakened from sleep? Even someone young, you could be slightly confused. If you were sleeping, then you're jarred awake, you could be confused. That patient getting up from sleeping, getting up to go use the restroom, they could do what? They can fall. Right? So you want to teach the patient to empty their bladder before going to bed. Number 2 is the correct answer. Now, choice number 1, 3, and 4, you're ringing in the ears, the hunger, thirst. All of these can interfere with sleep, but the most common one is the full bladder by far. A patient states, the pain moves from my chest down my left arm. The nurse identifies that the characteristic of pain associated with the statement is 1, pattern, 2, duration, 3, location, or 4, constancy. And the correct answer is 3, location. Go back to the question. It says the pain moves from my chest to my left arm. They're giving the location of the pain. Now let's look at our other choices. 1, pattern. Guys, the pattern would be the onset, the duration, remission, Those are the pattern of pain, okay? The recurrence. Choice number 2, duration. Duration is a type of pattern. Choice, and by the way, duration also means the amount of time that it lasts. And choice number 4, constancy. That's, explaining whether it's ongoing or intermittent. Okay, so guys, the correct answer for this question is 3, location. The nurse is caring for a patient who is experiencing pain. The nurse understands that a common psychological patient response to pain is 1, experiencing fear related to loss of independence, 2, developing an increased tolerance to the drug, 3, asking for pain medication to relieve the pain, or 4, verbalizing the presence of nausea. And guys, the correct answer is 1, experiencing fear related to loss of independence. So this is normal when the patient's in pain, and if that pain's been going on for some time, maybe going to chronic, that patient will have fear that they won't be able to do things for themselves anymore, or they're going to need to depend on somebody, or they're going to have a loss of control. Okay? Now, let's look at the answer choice number 2, developing an increased tolerance to the drug. That's actually a physiological response, not a psychological response. Choice number 3, asking for pain medication to relieve pain. That's a behavioral response, not a psychological response. Choice number 4, verbalizing the presence of nausea. That's a physiological response, not a psychological response. A psychological response is that fear, that mental thought that, I'm not going to have any control over my body, or I'm going to be dependent on others for the rest of my life. So number 1 is the correct answer. A patient has had a total abdominal hysterectomy and debulking for 4th-stage ovarian cancer. What should the nurse do first when on the second post-op day this patient complains of abdominal pain at level 5 on a 1 to 10 pain scale? 1, reposition the patient. 2, offer relaxing back rub. 3, use distraction techniques. Or 4, administer the ordered pain medication. And guys, the correct answer is 4, administer the ordered pain medication. So this patient had, let's see what kind of surgery. They had a total abdominal hysterectomy. So guys, this is serious manipulation of those pelvic organs. Okay, I'm surprised that patient started feeling pain on day 2. I give her a lot of credit for that. So this patient has PRN pain med. Patient says they're in pain. You're not going to be trying to distract them or give them a back rub. You better give them that pain medication that they have ordered for them. That's what you're going to do. Now, choice number 1, 2, and 3. If the patient has pain and you've assessed the type of pain that they have, you're waiting to notify the doctor that the patient has pain, see what the doctor wants to order. In the meantime, while you're seeing what the doctor wants to do, you want to give them a back rub, you want to do distraction, all that good stuff, wonderful. But something like this, a major surgery where there was huge manipulation of those organs, where we expected that patient's pain to be way more than a 5, and they're only at a 5 on the second day, we're going to give them that pain medication. It's ordered. They have an order for it. It's not like the patient doesn't have an order and you're waiting to see what the doctor wants to do. They have it ordered for pain. Give it to them, okay? A patient's diagnosed with a narcolepsy. The nurse's primary intervention should address the patient's 1, inability to provide self-care, 2, altered thought processes, 3, excessive fatigue, or 4, risk for injury. And guys, the correct answer is 4, risk for injury. Our priority is always going to be the patient's physiological integrity. What is keeping that patient alive and safe from harm? So when you look at the choices you have here, 4 is clearly the correct answer. Everything else can wait. We want to make sure that our patient is safe. A patient is experiencing discomfort associated with gerd. The nurse should teach a patient to sleep in which position? 1, semi-Fowler's, 2, right lateral, 3, prone, or 4, Sims. And guys, the correct answer is semi-Fowler's. Really, guys, should have been high Fowlers, but remember, when it comes to nursing, you're not always going to get the perfect answer, so you're going to choose the best answer for the choices that are given. Now, for this selection of choices, by far, it's going to be semi-Fowlers. Why? Think about what GERD is. This is the stomach contents, including hydrochloric acid, creeping up from the stomach, passing through the cardiac sphincter, and going into the esophagus. Remember, the lining of the esophagus was not created to be able to handle the acidity of hydrochloric acid. So it causes a burning sensation to the patient. That patient feels like they're having heartburn, chest pain. That's why they have to sleep with the head elevated, because gravity will help keep the gastric contents in the stomach. But these other positions, the right lateral, the prone, Sims, that puts pressure on the abdomen, which can help force that cardiac sphincter to open, which will allow all of the gastric contents and the hydrochloric acid to creep up into the esophagus where it is not supposed to be, okay? So guys, our correct answer is number 1, semi-Fowler's position. The patient complains of pain. When caring for this patient, the most important thing the nurse must recall is that 1, the extent of pain is directly related to the amount of tissue damage. 2, administering opioids for pain will eventually lead to addiction. 3, the person experiencing pain is authority of the pain. Or 4, behavioral adaptations are congruent with statements about pain. And guys, the correct answer is number 3. Pain is whatever the patient says it is. Pain is whatever the patient says it is. It is not something that's measurable. It's not something that's objective. It's subjective. Whatever the patient says it is. The correct answer is number 3. All right, next question. A patient is experiencing anxiety. Which aspect of sleep should a nurse expect will be affected as a result of anxiety? 1, onset, 2, depth, 3, stage 2, or 4, duration? And guys, the correct answer is number 1, onset. If the patient has anxiety, they're nervous, they're anxious about something, their brain is going, it's going to be hard for them to fall asleep. So the correct answer, guys, is onset. A patient requests pain medication. What should the nurse do when first responding to the patient's request for pain medication? 1, use distraction to minimize the patient's perception of pain. 2, place the patient in the most comfortable position. 3, administer pain medication to the patient quickly. Or 4, assess the various aspects of the patient's pain. And guys, the correct answer is number 4. The first thing you're going to do is what? Assess, ADPI. Assess, diagnose, plan, intervention, and evaluate. The first thing in ADPI is assess. Patient says they're let me give you an example. Patient just had surgery. Remember the patient with the abdominal hysterectomy? Let's use that patient as an example. They just had surgery, and it's 2 days later, and they say they have pain. What do we do first? Yes, if there's an order for pain medication, but before we give them that pain medication, we're going to ask some questions. Where do you feel pain? That patient had an abdominal hysterectomy. What if they say, oh, the pain's on my left butt cheek? The left butt cheek. And then you go look at the patient's left butt cheek and you realize they were sitting on a sharp object, and that's what was causing the pain. And the pain was not from the surgery that they just had, right? You would have medicated that patient for no reason. So you're always going to assess first. What is assessment? Anything that gathers information, anything that garners more information, whether it's a physical assessment looking at your patient, whether it's going into the patient's chart and getting information, whether it's asking the patient questions such as the pattern of pain, the onset, the duration, the type, is it sharp, is it stabbing, is it shooting, does it move from one place to another, anything that guys, you know I can't talk. Anything that garners information is a type of assessment, and that's what you're going to do first. Which statement by the patient to the nurse indicates a precipitating factor associated with pain? 1, I usually feel a little dizzy and think I'm going to vomit when I have pain. 2, I usually have pain after I get dressed in the morning. 3, my pain usually comes and goes throughout the night. 4, my pain feels like a knife cutting right through me. And guys, the correct answer is 2. I usually have pain after I get dressed in the morning. Now, why is this our answer? Let's go back to the question. The question is asking about a precipitating factor. Guys, a precipitating factor is anything that induces or precipitates, okay? So with that being saying, induces, precipitates, aggravates, make it even worse. So with that being said, look at number 2. I usually have pain after I get dressed in the morning. So getting dressed in the morning is that trigger, what may induce, what may precipitate that pain. That is the correct answer. Now let's look at our other answer choices. 1, I usually feel dizzy and think I'm going to die when I have pain. Not after, when I have pain. Choice number 3, my pain usually comes and goes. That's intermittent, guys. And number 4, my pain feels like a knife. Them describing that pain, they're actually describing the quality of the pain, okay? But the question is asking what is the precipitating, what induces it, what aggravates it. So number 2 is the correct answer. Of the options presented, the most important nursing intervention that supports a patient's ability to sleep in the hospital setting is 1, providing an extra blanket, 2, limiting unnecessary noise on the unit, 3, shutting off lights in the patient's room, or 4, pulling curtains around the bed at night. And the correct answer, guys, is limiting unnecessary noise on the unit, okay? That is the correct answer. Why? Because, you know, nurses laughing, kikiing at the nurse's station, doctors barking orders, the phone's going off, fax machine, family in the hallway talking. That is the most disturbing thing to the patient, and they will not get much sleep. So you could do 1, 3, and 4, but if there's all this external noise in the environment happening, it's going to be hard for that patient to sleep. That's why number 2 is the correct answer. And guys, I can't believe we're already down to our last question. So here we go. A patient has a history of severe chronic pain. One of the most important guidelines associated with providing nursing care to the patient is 1, determining the level of function that can be performed without pain. 2, focusing on pain management intervention before pain is excessive. 3, providing interventions that do not precipitate pain. 4, asking what an acceptable level of pain. And guys, the correct answer is 2, focusing on pain management intervention before the pain is excessive. Why? Because if we wait until that pain is excessive, we wait until then to give that patient a narcotic or whatever they need. You think that's going to touch that patient's pain? Absolutely not. And so this is why PCAs are such a wonderful tool used. Number 1, that patient feels like they have some type of control because they feel like the minute they feel pain, instead of pressing the button, waiting for a nurse to come, their anxiety rises. They know as soon as they press that button, as long as it's within the allotted time, they will get the pain relief. Okay, you want to catch that pain before it becomes excessive. By the time it becomes severe, you give that patient that narcotic, the opioid, or whatever that was ordered, it's not going to help them. It's not going to even blunt the effects of pain. So guys, number 2 is the correct answer. Guys, I hope you found this video to be helpful. If you want to see more questions on pain, sleep, comfort, let me know in the comments. Please help support my channel by sharing my content. If you know any nursing students or new grads who are studying for their NCLEX that you think could use my teaching, please share my content. Please don't forget, guys, my audio lessons are available on my website. Check that out. Check out my other social media handles. And I thank you so much for spending your time with me on this video, and you'll be seeing me on the next video.